Rick, I think we'll stay with you for the next question. When Walgreens stepped up to the call from the federal government to roll out the COVID vaccine, you also took on the complex logistical issues that accompany that task. One concern that became quickly apparent was the issue of vaccine equity. What have you learned so far about how to practice equitable distribution of a vaccine?
First of all, we are absolutely committed to equitable access to vaccines across all Americans. And so if you think about where this started, it started with the most vulnerable and where the highest mortality rates were occurring, and that was in long-term care facilities. And then if you look, the next most vulnerable populations were in underserved communities, sometimes Black and brown communities as well. And I think a lot of work had to be done to really understand what were the gaps, what were the challenges, and how do we just come together to really solve those types of challenges. And so we did take a step back and say, our job is really to help educate, and our job is to help vaccinate. And so what we've done is really hold together what we consider our vaccine task force, or equity task force. And it's really focused on 3 different areas, because how we look at it is access is one of the challenges, right? One, that we may be in 9,100 locations across America, but we're not in every community. And so you can't just expect everybody to be able to come into a pharmacy, to a hospital, or wherever it's going to be. We've got to take a vaccine to them as well. So there's a lot of work being done to really work locally. And when I say local, I mean hyper local, to understand where we're not getting care, and then how do we partner in that unique community to really solve the gaps that may be there. So a lot of work being done with access to really make sure that not only it's there, but we can also take it into those communities as well. Second, you hear a lot about hesitancy, and it's good to hear more recent reports of that hesitancy starting to lift a little bit. And I think people are becoming more willing to get vaccine, but I think there's still a lot of hesitancy that's out there, and education and information is critical for us to really start to share effectiveness, where we're going, and how we can really ensure that it's the right vaccine for the right individuals. So pharmacy can't be the only place for that. So, we are a trusted profession, but we've got to work with local communities, whether it's going to be, Chicago Urban League in Chicago, or in Atlanta, we may be working with church groups as well. You've got to really understand that local place of where healthcare really intersects, and how do we really, impact and influence that as well. And the third, I talked about a little bit before, it's a lot about partnerships, right? So how do you really understand where the gaps are and the challenges are to solve for them? The CDC has come out and said in Black and brown communities, one of the biggest reasons that they're having a lack of vaccines is going to be 2 things. One is hesitancy that we talked about, and the other is transportation. So we've gone out to really find a partnership with transportation, which is Uber, who is committed to 10 million rides that are either free or reduced fares for those that actually have transportation issues to get vaccines. And so what we're doing is really trying to say, how do we bring those solutions so that we can actually help impact and improve vaccine rates in all communities that we do serve. So that's kind of how we're approaching those going forward as well.
That's such a creative partnership with Uber to help address this kind of larger issue that's kind of beyond Walgreens' purview, but it's just a really creative solution for the community.
Well, and Holly, I'll just add on that. I'm sorry, I should just add on that real quick. It's fascinating. We have clinics that are happening in Atlanta tomorrow, so you'll hear about them tomorrow. But we have 3 churches that we're doing vaccinations in. One church, we've been using Uber because that's how they wanted us to help support them. And of the 2,000 vaccines that they're going to give, over 1,800 individuals said that they were interested in trying to get Uber ride because transportation is a challenge. So I think it goes to show you that we've got to really look out there and say, how do we partner to really have a bigger impact?
Absolutely. And taking that holistic mentality, right? Not just focusing on the vaccine itself, but holistically, how can we get people there and bought into the idea? That's great.